On Powerplan creation and maintenance. This tutorial is applicable for all medical providers in the inpatient and outpatient setting. In this tutorial, we will cover the following items. What is a Powerplan? How to share a Powerplan, how to create a Powerplan, how to change a Powerplan for updates over time, and how to delete a Powerplan. So let's get started. What is a Powerplan? Up to this point, many of us have a basic understanding of how to place orders and complete background information prior to signing the order, such as a complete metabolic panel for a diabetic patient ordered as a routine blood draw to be drawn as a future order in the clinic lab. Many of you may have created favorites which allow you to place the order without having to constantly complete the vital information to characterize the order prior to signing. We all understand how time-consuming it can be to place orders which have not been pre-completed as favorites, or even to have to select multiple favorites from a list of saved favorites, sometimes across multiple folders to complete the orders you need for a visit. A Powerplan is a set of orders within the Cerner electronic health record which have been grouped or bundled to perform a certain task. Powerplans can contain orders such as lab orders, radiology orders, medications as prescriptions, and those distributed in clinic, consults, follow-ups, billing, and even communication orders for nursing and medical assistant staff. Orders necessary to complete an entire visit may be contained in a single Powerplan, increasing the efficiency and streamlining the process of completing that portion of the medical visit. It's important to remember that diagnoses are not attached to a Powerplan and must be assigned after a Powerplan has been initiated. You can create Powerplans based on accomplishing a set of grouped tasks, such as grouping a list of potential follow-ups and billing order choices as shown currently, or you can create Powerplans which are specific to a particular visit, such as a routine diabetic follow-up, a routine well-child 4-month visit, or an uncomplicated urinary tract infection in the urgent care. Let's take a look at each of these examples as they appear in a Powerplan. So currently we're looking at a discharge Powerplan, which has been used to discharge a particular patient. And you can see that there are several follow-up choices with the order details completed for selecting what you need in terms of a follow-up and selecting a billing level to complete that and send it as an order. You'll notice that you can select multiple items off of this list by clicking in the appropriate checkbox, noting that whatever you select will then constitute a particular order once this Powerplan has been initiated. If we move over to the routine diabetes Powerplan, you'll notice that there are several different types of orders that are grouped and bundled, as in medications, laboratory, diagnostic tests, consults, as well as what's listed as clinic and office visits, which are our billing codes. You can see that this Powerplan has been organized to allow you to have pre-selected orders for routine default orders when you're seeing that particular patient, which include lab orders, a follow-up, and a billing order. However, if additional orders are required during that visit, they simply need to be selected and they can be ordered as well. On the Well Child Check Powerplan, you can see that there are several choices for various vaccines in this Powerplan, which also include medications such as multivitamins and nystatin, depending on the circumstances that you might find during a routine well child visit. The vaccines have been ordered and are pre-selected based on the patient's age at the time of the visit. This being a 4-month well child visit, these are the typical vaccines which might be given for a well child check in a child that has received all previous vaccines and is up to date. You might find yourself ordering additional lab studies during that visit, as well as a routine follow-up, which has already been selected in 2 months for a 6-month well child check. Additionally, other billing orders, such as the developmental screening and other visit codes, have been selected as pre-selected items so that once this power plan has been initiated, all of those orders can be completed simultaneously. Navigating over to the Urgent Care UTI power plan, one can see that there are multiple antibiotic choices which have been pre-selected for a typical patient presenting with urinary tract infection symptoms. You can see that the UA chemical and urine culture have been pre-selected. Antibiotic choices have been pre-made, as well as a follow-up with scheduling with the primary medical doctor and the billing code for just a simple UTI. Let's talk about how we share power plans. Many of your colleagues have already begun creating and using power plans as part of the normal workflow, and certainly there's no need to reinvent the wheel. As part of a collaboration, we should invite others to share the power plans we create and possibly improve on them, if not customize them to meet individual needs. On your dashboard, you can locate the new orders header, new order entry header, and locate the Shared Favorites button. If you click that button, you can enter the name of any provider you know has a completed favorite or power plan you wish to use. By selecting that particular provider, you can navigate to the appropriate folder and click on that order to place the order in the order bin. Notice that the order bin appears up at the top next to the Depart Discharge Process icon. If I select My Plan Favorites, I can see all of the power plans which I have created, which are accessible by anyone who has this new order entry header. By placing that order, I have now placed that order in the bin. By clicking on the green order bin above, you can view the orders placed and modify them by clicking Modify. When the order detail window appears, you can now locate the Save as Favorite button and save the power plan to your personal list. You can also order or modify that power plan at any time from your own personal list of power plans. So once it's been saved, it now appears in your own personal list of power plans. Let's now discuss how power plans are created. By clicking the plus add button from the order menu list or from within the order window, you can search for a power plan template. Selecting Power Plan Template will bring up a blank template containing no orders. This is a blank slate which will allow you to place new orders which can be customized according to your preference. Paying attention to the icons in the order window, we notice the Add to Phase drop-down. This menu gives us choices on which orders to add. As you can see, we can add orders, we can add an outcome or intervention, or we can add a prescription. Selecting orders brings up the familiar order window, and you are given an opportunity to select the orders from within the standard search or to include favorites, which you may already have created. By selecting the orders, you can build your power plan order by order. Pre-planning your power plan is always helpful, as you can place multiple variations of the same order within a power plan, such as a fasting versus routine order, or multiple follow-up options, so you can select what you want when the power plan is called up during the visit. It also helps you to organize the plan so the orders take a logical sequence. For example, gradually increasing follow-up visit choices from 1 day to 1 week to 1 month to 3 months to 1 year. You may be able to complete the orders on some orders placed in the Powerplan. You may be actually unable to complete the orders on some orders placed in the Powerplan, such as open-ended consults or follow-ups, or procedures requiring additional information to be provided at the time of the visit. It's also important to note that care sets cannot be added to a Powerplan. Let's take a look at this. When all the orders are in place, you can select each order and complete or confirm the specific order details. If you've selected orders from your favorites menu, you can expect that most of the order details will have been completed. In this case, we will complete the orders for this routine CBC and this routine comprehensive metabolic panel. I may also choose to add a fasting comprehensive metabolic panel as an option. You will notice that not all of the order details have been completed, as the only thing missing is the diagnosis, and we will get to that in a little bit. When all of the specific order details are completed, you should save your Powerplan, assigning a unique name which you will use to call up during the visit, such as Routine Diabetic Powerplan. You will also notice that the date of the creation and or update of that Powerplan is always saved along with your unique name. One thing you will notice is that all of the orders have been selected. In order to set default preferences for orders, we will need to remove the Powerplan and reorder the plan. If we don't do that by deselecting an order, we will notice that all of the order details have been removed from that order. We will have to re-enter all of the information again afterwards. When the Powerplan is reordered, you will see that plan has all of the orders selected. So we can remove this by right-clicking and selecting Remove. If I then reorder that Powerplan, you will notice that all of the information has been retained, and by deselecting this order, I have not lost the order detail. I can now select the orders that I wish to retain as a default and then resave that Powerplan. At this point, I will overwrite the Powerplan, retaining the name, and the only thing that will change is the date upon which we updated or changed this Powerplan. At that point, you can now create another Powerplan or begin using the current one. Please note that prescriptions placed in Powerplans may not retain the quantity and pharmacy information, and this may not automatically be carried over, so this will need to be modified after initiation of the Powerplan. In order to initiate a Powerplan and actually sign the order, you will need to navigate over to the Initiate button. You will notice that the check marks have now turned into light bulbs. We must then at that point assign a diagnosis. And because there are no diagnoses assigned to this particular patient, we'll assign a diagnosis quickly. Then navigate over back to our orders. And we can select the DX table. And you'll notice here that a diagnosis can be placed for each of these orders, which then completes all of the orders, and they're ready for signature. Once the orders for signature button has been clicked, we can now sign these orders, and they will be sent to their respective departments. How do we update or modify Powerplans? Powerplan orders can only be modified after the plans have been initiated. When you call up a Powerplan for modifications, please be sure to select the orders you wish to modify. If you will add any orders, simply select the Add to Phase icon from the drop-box menu and begin adding new orders. Keep in mind the Powerplan structure and sequence of orders may be altered as a result. So let's test this. We'll call up a Powerplan. We notice that the Powerplan is mostly complete, but I wish to add another order. I'm going to navigate to the Add to Phase drop-down, select Add Order. I want to make sure that this medication that I'm going to add comes from my in-office stock, and so I'm going to place in the Pneumovax 23 and select that item. And once that item has been selected, we'll notice that it has now appeared in the medication section of this Powerplan. As most of the details of this vaccination has already been completed, the only thing missing is the diagnosis, which is typified by the blue circle with a white X. And I can now save this as my favorite. From this point forward, every time that I order my routine diabetes Powerplan, I will also have information for the pneumococcal 23 polyvalent vaccine, or Pneumovax 23, included with the list of medications along with the influenza virus vaccine for diabetic patients. So in summary, new orders added can be modified and the details completed prior to initiating that order. Any orders previously set and saved must be modified in an initiated state. So if I wish to modify this order here, I must initiate this in order to now change the status of any part of this in the details. Once this order has been modified, I can continue to save this as my favorite, and all of the order details will be saved along with that change. Let's talk about how to delete a Powerplan. If you have added a Powerplan and wish to remove it, you simply go over to the Powerplan, you right-click and select Remove. You'll notice that this View pane allows you to view orders that have been placed and Powerplans that have been selected, whether they are in an initiated or planned state. If you wish to remove a Powerplan that has been created and placed in your favorites list, you simply right-click that Powerplan and remove Plan. Verify that you wish to perform this action, and that Powerplan will be removed. As you can see, if Powerplans are planned, built, and utilized appropriately, They can truly enhance and streamline a visit workflow for improved efficiency to save time. This concludes the tutorial on Powerplan creation and maintenance. I thank you for joining me.